Welcome to the Healthy Hustling Podcast. I'm your host, Dr. Eric Broadworth, and today I've got with me Dr. Shivani Gupta. It is a pleasure to have Dr. Shivani on the podcast, and what we're going to be talking about today is extremely interesting. Going to talk about Ayurveda, turmeric, and some supplements, and helping with overall health and even pain relief. Very, very interesting topic because I think a lot more people, you're going to find this interesting if you want to take a holistic approach to your health. If you want to fix your body really from the inside out, you don't want to rely on pain medication or prescription medications. This episode is going to be for you. She brings about a wealth of knowledge. She's been featured on multiple podcasts, has her own podcasts. Thank you so much for coming on, Dr. Shivani.
For sure. Thanks for having me.
Awesome. So, do you want to tell everyone a little bit about your background, a little bit further on anything that I might have missed right there?
Sure. I grew up in two worlds. I grew up in Houston, Texas, and I grew up going to India every year of my life. And so most people have not heard of Ayurveda yet. But as a kid, Ayurveda is what was used on me to get me healthy every single time I got sick. So in the US, when I got sick, we'd go to the pediatrician, they'd give us a script for antibiotics, and I probably took 50 courses of antibiotics as a kid. And when I go to India and get sick, my grandma would just go into the spice cabinet, mix up some spices into a tea, and give them to me and heal me. And by the time I reached college, I thought, what is the problem? Why am I so sick all the time? Everyone else has an immune system that works. Somehow mine is missing. Like I didn't get one. And there's this thing called yoga and Ayurveda here in India. And so I asked my parents, I said, "Can you guys just give me a minute? Like I need to go figure this out. I think it's the way that's going to fix my body." And so luckily for me, they had time and space in their lives, and we went on this quest together and studied Ayurveda in India. And so what I love to share with everyone is that Ayurveda is this ancient system of medicine from India. It's over 5,000 years old, and it's really an ancient modality of wisdom that shows us different ways to build our health. And so that's why I love sharing Ayurveda is it helped me build a gut, an immune system, everything that I needed. And my mission is just to keep finding those nuggets of wisdom from there and share them with us here in the West so we can have that health and vitality that we deserve.
That's awesome. So, I guess tell everyone a little bit more about Ayurveda. Is that like, is it a spice? Is it a supplement? Or is it a practice?
It's really a practice. And so there's these ancient texts that were downloaded and received. And in these texts, they basically teach you what we call the science of life. That's what Ayurveda means, the science of how we should live our daily lives. And the entire goal of it is to help us bring body, mind, and spirit into alignment. And so it covers different things like circadian rhythm. The circadian clock came from Ayurveda. And the main mission there is to show us how to live in rhythm with the sun and with nature instead of defying it all the time and then having all these health struggles that so many of us are struggling with right now. You may have heard of circadian sleep and really applying the circadian rhythm to sleep, which is important as well. Ayurveda teaches that gut health is the center of all health. So having a gut forward mentality in every aspect of your life is important. And that's the center of having that vitality that we want. We teach a lot about eating a sattvic diet. That just means a yogi diet, really paying attention to fresh, to nutrient density, nutrient variety, eating according to the seasons. A lot of the things we know, but we may not be really practicing and putting in place or prioritizing. Then Ayurveda teaches a lot about detoxing. And so we have these self-care rituals that we teach that you can apply in a daily rhythm that help you detox gently. And then we do teach a lot about the super spices. I call them superfoods that we can bring into our lives to drive really great results and get those health benefits that we want. And then one other final key area is what we call the doshas. These are your individual mind body constitution. So just like in, exercise physiology in these arenas, we call people ectomorphs and mesomorphs in these terms. In the same way in Ayurveda, we break people up into their elements. And we say you're either more air, you're more fire, or you're more earth and water. And knowing that template can kind of guide you in terms of the intensity you use, your diet, your schedule, your rhythm, your sleep, everything. And so those are the six pillars of Ayurveda that I like to teach from. If you read the ancient texts, I have them here behind me in my bookshelf. It covers every aspect of health, like surgery is talked about in there, every disease is mentioned in there and then natural solutions for that.
Wow. That's awesome. That's definitely a lot. So is Ayurveda, um how is it similar and different? You brought up yoga, right? So how is it similar and different from yoga?
So it's a sister science. So just like in yoga, so much of the point of yoga is really to bring us into alignment with our total peace and our spirituality. In Ayurveda, if you take that same practice of yoga and you bring it into your daily life and into your kitchen, we can't do yoga all day. We can't be in yoga poses all day. But the goal of yoga is that peace and that joy and that alignment. In Ayurveda, our goal is let me show you how to cook, how to eat well, how to support your gut health, how to sleep so well, and then how to use the spice kingdom of superfoods as well so that you can have this balanced body. And then when you go to yoga and do that asana practice, the end result, that shavasana, that peace that you want, your body feels great. And you can drop even deeper into that because you've got everything healthy. The problem is nowadays we've got a lot going on. At any different point, we can have leaky gut, mold issues, joint pain, some injury. So we have a lot of things in our bodies nowadays that are kind of alarms going off. I call that inflammation a lot of the time. But when those alarms are going off, then we're not feeling the peace that we want. We're not able to just stay in our parasympathetic nervous system. And thus, we're not able to have the health that we want to have.
Yeah. Let's dive a little bit into, you mentioned circadian rhythm, right? And circadian rhythm is so important. So, for those of you who don't know, circadian rhythm is your body's internal clock. It's what helps you fall asleep, get up in the morning. And if this is off, this has been shown to be crucial for your body's ability to heal, your overall longevity and mortality. I mean, you look at people with a poor circadian rhythm, for example, people who work third shift. If you're a night nurse or a factory worker, warehouse worker, and you're working third shift, your life expectancy is cut by like 10 years, I want to say. Like it's pretty significant.
Yeah.
And a lot of that is due to like your circadian rhythm. So, do you want to discuss a little bit further on circadian rhythm and why it's important for health? And then how does Ayurveda, like, how is that going to influence the circadian rhythm?
Absolutely. So in Ayurveda, we talk about the circadian clock and how we're meant to rise with the sun. We're not meant to sleep in till 10, 11, 12. When we do that, that gives us this lethargic and heavy feeling. We call that kapha energy if we're feeling really heavy and earthy in our bodies. So we want everyone to rise with the sun and leverage that energy of the sun rising in the morning. We have a cortisol release around 6 in the morning, so we're supported to wake up at that time. And then we want everyone to use their morning for good. So productivity. Also, exercise is really recommended in the morning, moving our energy first so we are in motion for the day. We teach that on the circadian clock, 12 to 2, when the sun is highest in the sky, is when we call pitta time of day, fire time. So you can imagine 12 to 2, really 10 to 2 on the clock, is when you're most supported to digest your biggest meal of the day. So for example, a lot of times nowadays we'll skip breakfast. Many of us will have like a high protein salad or really dialed in lunch. Will be really good for the majority of the day. And then we get to dinner and we make dinner the biggest meal of the day. And Ayurveda says that's not the right rhythm for food. Not everyone has to have breakfast, lunch, and dinner. I know a lot of us practice intermittent fasting right now. But lunch is meant to be when you're most supported to get the most nutrient density and absorption out of your meals. So we teach make lunch a real good meal. Put your nuts, your seeds, anything hard to digest in that meal, raw foods as well, so you can absorb all those benefits. And then we teach as you're going from 2 to 6, you're going to have what we call the vata time of day, more air. So you might find it easier to run around, get small things off your to-do list. You're not going to have the same brain power and focus for thinking, strategy, and bigger tasks that you do in the morning. And most of us intuitively know that, but some of us try to push through in the 2 to 6 lot and get so much done.
Yeah.
And it's about can you just have a different type of list that you're executing in that piece of the day? And
Yeah,
then from
I
6 to
find that I
10,
like around like 4 or 5 o'clock, right? You kind of start to check out a little
yeah,
bit. I'm not as clear necessarily mentally a lot of times later in the day for sure. So I can definitely
exactly.
relate to that.
Exactly. And so our job is just to acknowledge that instead of fighting ourselves. Say, you know what? I'm just going to do list building tasks or small follow-up tasks or whatever is easier if you are going to work later into the day. And then Ayurveda says 6 to 10, we're meant to wind down. And that's where it gets interesting. Nowadays, so many of us are entrepreneurs, we're parents, we're doing a lot. I know for me, now that my kids are older, I can work 6 to 9 as if its own work day and really grind and get things done. But Ayurveda says, listen, you are meant to wind down with the sun. The sun starts setting at 7 o'clock based on where you are, and you're meant to do that. So what I try to do is go for evening walks. I have a morning walk, I have an evening walk. And those are my easy ways to align with that circadian clock. And because we walk after dinner, I always teach finish dinner by 7, finish all work activities by 8, finish wrapping up your house and responsibilities and things by 9, and then start your sleep hygiene rituals because those sleep hygiene rituals are what's going to cue the mind that bedtime is coming. The problem is nowadays we're like work, 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 iPhone, blue light, try to sleep. And then we wonder why our sleep quality isn't great. And on that clock, Ayurveda says that 10 to 2 is the most important time for our body to clean and clear and rejuvenate. And so if you really use that time slot and sleep by 10, those hours of 10 to 2 are twice as important for your health as your 2 to 6 time slot, which is a profound thought because so many of us go to bed at 11 or 11:30, maybe even 12. Many of us consider ourselves night owls. But Ayurveda says that fire that you're using, that 10 to 2 fire, can be used for work or it can be used for detoxing and rejuvenating. And one fact I love is we can collect up to 3 pounds of glymphatic waste in our brains if we don't give ourselves that time slot to sleep. So many of us are running around brain fog, tired, overwhelmed, and sleep could have been the key on the circadian clock to get rid of that. So those are some of my favorite points from the circadian rhythm in Ayurveda.
Yeah, I completely agree with that. I mean, sleep is so vital, and oftentimes I can be guilty of it where,
Yeah,
you're scrolling on the phone at night, everything like that, when really you shouldn't even bring your phone in the bedroom, really, in a perfect world. You're just going to
true.
use an old school alarm clock just because that phone, it's not healthy for sleep at all.
Correct.
Um, so that's all super interesting. So how do Ayurveda and turmeric, like, let's talk about that a little bit.
Sure.
How how do those mix? Does that make sense? Like how did you get into that? You have your own supplement company and things like that. Is that correct?
Yes.
Yeah.
Yeah.
So tell us a
So
little bit about that.
totally. So I was in my master's degree for Ayurveda. I was like, I'm going to write books and change the world. That's my dream. And as I sat there in herbology class, the professor kept explaining each benefit of each spice. And I kept thinking, I'm Indian. I eat those spices every day. Those are in my dinner that's been made my whole life. How can you tell me that fennel and cumin and cinnamon and cilantro as a heavy metal detoxer, cumin as a pre-digestive for all beans and lentils, fennel can soothe heartburn and bloating and indigestion after a meal. Cinnamon can balance your blood sugar.
Mhm.
Ginger is such a gastro-supportive spice lining the gut lining. I just sat there flabbergasted. And I was like, you're telling me that I'm over here trying to stuff goji berries and maca in things in my protein shakes, and those superfoods that I think are gross are these super spices are as effective as those? And they were like, yes, absolutely. You just are underestimating their power. And I thought, okay, that's interesting. Because here in the West, we need solutions that are bite-sized and easy. We all have busy lives. I can't do everything that I teach every day. I'd never work. So I always am trying to pull like what are the most effective ones? Is it the circadian clock? Is it a tongue scraper? Or is it these spices? And so once I heard the benefits of turmeric, I was like, that's insane. I don't even believe what you're saying to me. I'm going to go study that further. And so I had an advisor who was like, "You really need to do a PhD." And I was like, "I don't think you understand how unfocused I am. I just want to write books and impact." And he's like, "No, trust me, you should do the PhD. What would be your topic?" And I said, "Well, I'm really fascinated by turmeric. Like, if turmeric can do what they say, why is all of Western medicine, when I go to the doctor, why aren't they offering it as an option? Like, there must be a reason." And so I did years of study on turmeric. it can affect so many areas of the body. I'm truly an evangelist of it because turmeric is a very powerful anti-inflammatory. We have thousands of studies in PubMed on that because of how it affects NF-kappa B, TNF alpha, and then over 30 different pathways of inflammation in the body. So it's like it affects the master switches of inflammation. So it's a very big area of study in the scientific and medical community right now because it has such great impact. Then it's a powerful reverser of oxidation. So it's an antioxidant and it reverses the oxidative species that are causing oxidation in the first place. So it's a preventer as well. And then what I loved the most was it's antiviral, antibacterial, and antifungal. And as a kid who had no immune system, I was like, this is my new barrier shield against the world. Now I never have to get sick again. And so I
I did not
really
know
love
that it's
it.
antiviral, antiviral, and antifungal. I did not know that at all. I knew about the anti-inflammatory properties of
Right.
it, and I think that's been what's really been touted the most, right? With turmeric, but I didn't know those other things.
Yeah, it's super fascinating. It's an immune modulator. And so for so many people who are constantly sick or always looking for solutions that are natural, I thought that was super compelling. Then recently I presented at some longevity conferences, and so I dove deep into the research again, and it has an impact on sirtuins, AMPK pathways. It causes neurogenesis, mitogenesis, which is amazing because we are so obsessed with mitochondria right now and the energy we want to have as we age. It functions in the same pathway as metformin, so it can have a metformin-like effect when we talk about anti-obesity. It affects
So how
glycation.
is similar to metformin? How does it have an anti obesity effect? How does it affect obesity?
So the way I've read it is it impacts the AMPK pathway, which is what metformin impacts. And then from the anti-obesity standpoint, I look at that as if you reduce inflammation and we get ourselves out of the inflammation cycle, then we're gonna support ourselves when it comes to obesity. Because a lot of times that catch-22 exists
Gotcha.
where we want to reduce obesity, but we're inflamed. And so we're just not winning at it. And turmeric is so powerful there. So to me, it's a wonderful spice. Can it do everything in the world? No, nothing can. But my first goal with turmeric was how can I take this to doctors who treat me and give it to them in a trustworthy solution they'll use? So I built it for orthopedics. And that was my dream 10 years ago. I'm married into a family of all doctors in South Florida, so I just used my network to get into every door I could. I met lots of PTs and chiropractors and orthopedic surgeons, and it took a lot of convincing. It was pre-pandemic. Post-pandemic, the world's easier to talk to on this topic. But I really got in there and said, look, you're going to offer something to your patient every day. And a lot of your patients are like me, and we can't always take all these different solutions you're giving us. They give us stomach aches, they have side effects that some of us don't like. So can I give you a natural alternative and will you just try it? And they'd say, sure, I'm going to give it to my three hardest patients. I'll let you know if it works. And that's always fun to me because then it's the product standing for itself.
Yeah.
And eventually, some of those orthos told me, they were like, your product is what they're running in here for every month. They're not even coming to see me. You've reduced my opioid use out of my practice because I'm using this as a post-op solution. So, turmeric, my dream is to show everyone how effective it is for pain and chronic joint pain. And then, of course, it has a lot of other applications, but
So
that's kind of where I started.
how quick I have a lot of questions when
But
it comes to this. How
yeah,
quickly are you finding that it works?
sure.
And as far as like dosage, what should people be doing? Because from what I've seen, and I think that turmeric's great, but from my understanding, based on a previous podcast episode too that I'd done with someone, they had mentioned that 28 days it
Mhm.
takes to really build. You got to build it up in your system, really. And they mentioned 28 days at a proper dosage. Do you find is that the case? What are your thoughts there?
So in the literature, we show that 500 milligrams of curcumin extract with 4 milligrams of black pepper extract is a good dosage twice a day. So the typical recommendation is going to be 1,000 milligrams of curcumin per day, and then that black pepper will increase that absorption by 2,000%. And as you probably know, out of the entire turmeric plant, only 3% is the curcuminoids. So we're leaning on that 3% to drive that powerful result. It's interesting, over the 10 years, I've met so many people and I get to hear all the stories of what happens. If I meet a yogi who's like thin and wiry, who drinks green juice all day, she'll tell me next day she felt it. Like I've seen that a lot of times. People are like, whoa, that was strong. most people with normal digestion, which is the majority of us, it takes 3 to 5 days before they're like, I'm feeling something. Something's feeling better. Something's working. I can't quite pinpoint it. And then a lot of people tell me, yeah, I took it. I don't really know what happened. And then I stopped. The minute I stopped, a lot of aches and pains and stiffness and joint pain and weird inflammatory things like allergies or gingivitis, for example, all sorts of things came back. And then I realized what it was doing for me. So I typically say 5 to 7 days, up to 10 days max, that someone should be feeling something that the turmeric is actually landing and doing its job. Because in my experience, it does, it goes after the big problem, then the medium problems, then the small problems. So, like you're saying, after 28 days, it's approached the bigger problems. Now it's going to go refine into the smaller arenas.
Interesting. And then 500 milligrams in the morning and at night. So,
Yeah.
is what you're recommending. And then it's got to be the curcumin with the black pepper, right? To get it, make sure it's bioavailable and absorbs into the body properly.
Correct.
Um, do you dose that differently? Like if you have a larger individual, smaller individual, and then, also, I'm just curious. We do a lot with like red light therapy, laser therapy. Does that help speed up the effects? I don't know. Maybe you know that, maybe you don't.
Oh, that would be a fun study to do. That is fascinating. Most people can take the standard dose. As the supplement company owner, my job is to say, take the dose on the bottle. But when I do sit down with people, and if they call on the 800 number and I talk to them, I try to understand where they're coming from. Because we know in the literature that you can take up to 8 grams a day of curcumin safely. So you have some wiggle room there. You could someone, not anyone I would recommend to, but you could take 16 capsules a day. Certain people do that if they're in certain populations or have certain, issues they're chasing. So a lot of people I talk to will increase to 3 capsules a day.
Okay.
Or I created a second formula called inflammation relief that has boswellia, dry ginger, amla, and all these things, but it has curcumin in it as well. And so they'll take both. And that's our way to support them to get a little more curcumin on board, but also all the other anti-inflammatory herbs from turmeric. And the thing is, a lot of people are going out there buying turmeric supplements, and they tell me, I'm already taking something. I just don't feel anything from what I'm taking. I bought it on Amazon or wherever. And
That's
so
what
I
I was
always
going
like
to
to
ask next is like, yeah, how, so does that matter?
it matters big time. So the quality of our supplements that we're out there buying off Amazon can oftentimes be adulterated, completely fake, not from the company we're buying it from. And I've seen that with a lot of my friends in the supplement space. They're like, yeah, someone just copied my bottle. It looks 90% the same. And that's what the customer's getting. So I ordered it and I got the fake too. So I think it's important that we buy supplements directly from the people who make them. And there's different classes of supplements. There's what's at your big box retailer and Amazon. And then there's
Mhm.
what's built for practitioners and functional medicine and practitioners like you. And in that arena, you can't play games. The practitioner knows if the product is good. My orthos know completely that it works, or they wouldn't waste their time recommending it. And in that space, we have third-party testing. So at that level of the game, we do pre, mid, and post-production. The extracts we're pulling, we are watching everything with our suppliers. Like I've known my same supplier for 10 years. I can pick up the phone and call and say, hey, is everything on board exactly the way I saw it in India last time I was there? And
Mhm.
we don't play games with the way we extract either. And so when you're at that practitioner level, you're really focused on how am I extracting at the right proportion to mimic Mother Nature so I drive the most powerful result. And so that's where supplements can be a world of difference. So I don't buy my supplements from the big box retailers. I go to my practitioners and say, who do you trust? What do you take? Because you oftentimes know, based on going to all the conferences you're going to, who's the best out there.
Yeah. Who is like, so you mentioned orthopedics, like who is the best person that needs to be, that should be taking this? And what are some, I guess, what's the most interesting story that you've heard if you had to pick one?
Yeah. So, for me, it's chronic joint pain is what we win at most, where you can tell what it's doing. When I've had acute pain, like a swelling up ankle, I can also use it for that. I definitely play with my dosing then, though, 'cause if it's acute, you really need to significantly bring down that inflammation. I have so many stories. One that I remember is this woman she was really overweight. and she had stopped doing anything in her life that was joyful. Like she had stopped traveling and she was just becoming a loner, really a recluse. I knew her from one of the women's groups I was in. And she started taking the turmeric and she goes, the first thing I noticed was that I could breathe. I had no idea I was only breathing out of one nostril. And I thought that was super interesting because as the creator, I love hearing where inflammation is bothering people, apparently it's a lot in the sinuses, and we don't realize sometimes the allergies and issues we have and how it's inflammation based. Then she said it reduced her back pain and she could move again, and so she booked a trip to Cuba to travel. And I was like, that's amazing. The level of quality of life shift we can create because you can move again pain-free is pretty profound. And in my own house, I had my father-in-law live with me for a number of years. I have my mom. All these people have chronic joint pain and need knee replacements. So the more we can support everyone in staying pain-free and keep that mobility, which is, I mean, a lot of the work that you do, then they have that quality of life that they deserve. So that to me is the most exciting part.
Yeah, that's awesome. So I'm hearing a lot of like arthritic issues. If you've got arthritis, a chronic pain, you just might think that you might have more inflammation in your body. You're trying to deal with that. Anything around surgery, like should people, you mentioned surgeons, right? So it's got anti-inflammatory properties. Correct me if I'm wrong, but I believe that it's a bit of a blood thinner.
Correct.
So should you be weaning off of it around surgery before you go into surgery? How does that all work?
Absolutely. My surgeons are pretty comfortable with it by now because they've been using it for 10 years. A lot of them initially, which is how I should say it online, would cut the patient off 7 days prior. So it's just not in the system anymore. And then about 3, 5, or 7 days after, they would restart the patient on it. If the patient's using it for pain and inflammation and trying to reduce their painkillers, because we know the painkillers can be very constipating. And so that's how my orthopedic surgeons like to use it. They offer it as that adjunct solution.
Okay. Anyone that shouldn't be taking it, like any contraindications,
Yes. The
pregnancy,
main one,
cancer, I don't know.
yeah, I mean, the main one is blood thinners. That's the one we tell everyone is if you're on a blood thinner, don't take your turmeric. It's a powerful supplement and it is vasodilating on the system. We would say that during pregnancy, just because in America, you don't want to give anything to a pregnant woman. In India, we're very comfortable with our spices, but here, yes, I tell everyone just take time off it. It is a warming spice, and so it can warm up the system a little bit. But other than that, we don't have any other contraindications that we talk about.
Okay.
Yeah.
Awesome. So kind of what I've learned from our conversation here, right, is that a lot of people, if you're dealing with especially chronic aches, pains, everything like that, we really need to evaluate our lifestyle. And so that can start with Ayurveda, right? And so fixing our circadian rhythm, living from a more holistic approach, not relying on prescription meds and um, being more in tune with nature and what nature's intended for us. And then also then using that in proper supplements like turmeric to help complement those things. A- Anything other than turmeric, I guess, that you would want to hit on like the benefits of the of that?
Yeah, I mean, turmeric's my number one favorite. I also love ginger. Not everyone can take turmeric. Some people have allergies to black pepper. Some people have allergies to turmeric itself. One thing I forgot to mention is curcumin with a healthy fat is also beneficial, especially if we want to cross the blood-brain barrier and support brain health. So a lot of people take their supplements with food, so they get both benefits. But oftentimes a curcumin black pepper supplement is already built for absorption, so it's fine as is. But I also love ginger. I think ginger is such a beautiful plant that we can incorporate in our food. It has such powerful gut support, anti-inflammatory support as well. So it's very useful. Boswellia is another plant that's very good for joint health and joint inflammation. So I love leaning on that one. There's amla from Ayurveda. Amla is like a very potent vitamin C. So a lot of times when we're using superfoods, we're looking for these anti-inflammatory but immune benefits like vitamin C and things like that in there. And the fact that that's an amla is really cool to me. So those are most of my favorites. My other one would be fennel. Someone recently said to me, I'm bloated all the time, especially when I travel. Which one can I lean on? I was like, fennel seeds after a meal is a very simple way to support the system instead of reaching for antacids. So I love when a spice can do what we would do with something else. And it's simple, it's natural, it's easy. It takes 5 seconds. So that to me is really fun.
Awesome. So do you work with people one-on-one? Obviously, again, you have the supplement company and everything like that, but do you work with people one-on-one?
Yeah, I would say number one, the supplement company is growing. It's beautiful. I have a team of five in there who are helping me teach Ayurveda and turmeric to the world. I do see clients one-on-one and love to sit down with women or men and guide them on applying the Ayurveda lifestyle to themselves. And then I have different programs on my website as well. If people are like, let me just learn the basics of circadian and these things. And if they want to consult with me, then we can do that or a group program as well.
Okay, cool. What's the best way for people to get in contact with you if they had questions, wanted to check out, what we're talking about here today?
For sure. My website is my name, shivanigupta.com, ShivanIGupta. The supplement line is called Fusionary Formulas for the turmeric. And I made you a special code. Dr. Eric will give them 15% off at Fusionary.
Awesome. And then is there anything else that you want to, I guess, one last message for people that you would want to share?
Yeah, I would love for everyone to pay attention to when they're inflamed. Our body is speaking to us, and every time we say, you know what, I'm just getting old, that must be what this is, that's a sign. You're not getting old, you're not aging, you're inflammaging. And so pay attention to that and shift your lifestyle to battle that inflammation, prevent all the things that come from advanced inflammation in the system. Later on, that's chronic metabolic disease. And so staying healthy and paying attention to those signals is really key.
I love that. I love that phrase inflammaging. I'm going to start using that. I think that that's awesome. I'm definitely going to have several of my patients listen to this episode, especially the ones who uh struggle. I hear all the time when we'll get down and I'll be like, are you sleeping? Oh yeah, I sleep like 5 hours a night. I'm like, okay, that's not enough. But then they really struggle to either fall asleep or stay asleep or whatever, and what and why. So I think that this would be super helpful for them. So I love that we're talking about this. I think that more people, I always say, like America, we're only getting sicker and fatter and more issues. And we need to look around us and really make a lot of these changes that honestly they're very low cost. It's very free and it's going to save you
Yeah.
so much money in your overall healthcare costs. It's wild. So I really appreciate your time on the podcast here today, Shivani. We'll have to definitely do this again. I think that there's so many other questions that I have and things that we can like go down a bunch of different rabbit holes.
For
Happy to
sure.
do this again. So thank you so much.
Yeah, thank you.